Well, hello, Dr. Vijay,
Hello,
and
sir.
welcome to Mallareddy Vishwavidyapit, the School of Digital Health. We are discussing about physiotherapy and digital health, and our podcast is named as DHIL, or Digital Health Interventions for Long Life. So, our idea broadly is one to understand physiotherapy from your perspective, the services that are delivered by the physiotherapist in a traditional way, or we'll call it as an analog way, and how digital health is actually transforming these services and perhaps making them better. So, broadly, this is the uh, idea for discussion. And we'll follow that up with also understanding how we can teach all these things to the new generation of students, because physiotherapy, the way that has been taught and the way it is being practiced, is changing, and this is where the School of Digital Health want to kind of be in the forefront of transformation. And these are the things that we want to discuss. But at first, let us know about you. So, if you don't mind me asking, we'll start from the beginning at when you are born, perhaps, and where you are born.
I'm a 80s kid. I'm born in Vijayawada, a city called Vijayawada in Andhra Pradesh, and then in August 5th. And then most of my education happened to, I've completed in Vijayawada, and then including my physical therapy. After that, I moved to Mumbai to start my professional career post my master's. I started working with a hospital called Kokilaben. It's a Dhirubhai Ambani's hospital. And I learned technology first there because by the time I joined, they have a gait lab. They have a very wonderful aqua setup.
Sorry to interrupt, sir. When did you join college? Perhaps like some year as a
2002.
reference. Okay.
2002. And then by 2009 and 10, I've completed my master's and I started working with Kokilaben, which is a place where I really felt great because till then it was only manual based physiotherapy, which is definitely good. And then suddenly seeing such a vast transformation and technology, they have a cardiac rehab center separately, they have a gait lab and a neuro rehab setup, and of course a huge volume of physiotherapists working, near about 30 to 40 at that time, which was very big in number. And it was a fully structured and then accredited facility. But unfortunately, I couldn't continue there very long. I was invited to work with care hospitals in Hyderabad,
So,
which was
when did you first come to move to Hyderabad?
2009 and 10. A very brief time I worked with Kokilaben, and I started working with because my master's is in cardiac. I've done my cardiac pulmonary rehabilitation in master's, so I choose to work in a cardiac specific facility, which was one of the best in that region at the time, where it was led by Dr. Somaraju Garu and all. So I started working with ICU setups, managing the departments both in ICU as well as in the ward. Eventually, we planned to start a cardiac rehab department. We didn't had a great department, but initial experiences, how to start, how to do that work as a project, all such learnings happened there. Because as a physical therapist in a school, if you say this kind of a knowledge is not being taught at that time, where other than treating a patient, how do you propose a plan for initiating a department? What are the other services? What is the trajectory that you have to go through to get funded or whatever it is? So it's a very new experience. It took a very long time. Then I happened to move to other hospital called Citizens, which was an American funded hospital. They also have an cancer wing.
And that's also in Hyderabad.
In Hyderabad, yes, cancer wing called American Oncology. So that's a very good space again. And then we started working from the scratch again. At that given hospital, I had a chance to work with a multidisciplinary team, be it orthopedics, neuro, onco, and then specifically pulmonary surgeons. So there is one good surgeon called Dr. Sai Andamuri. Now he is heading Roosevelt Park Cancer Center in US. So he's a transplant surgeon. Under him, I started working with him. He made me learn how to work on the lung pre and post operative. to the level where I used to measure all his patients' PFTs and then all such DLCOs. So I understand the volume before the surgery, and we used to discuss how to go about this patient, and very importantly, how much time this patient will take to come out of the ventilation. To this depth, we used to discuss, because it's a beginning time. It is a very early time, so I have time to spend with him, understand. Apart from that, we used to travel across the country, talking to different surgical groups, be it NIMS, Amrita, Kokilaben. So that's a very hands-on experience, if I can say. And then we have not done any transplants per se, but we have moved to that level where we could do one. But unfortunately, he have to leave to US again. He came with for a very short assignment here, 2 years. But in these 2 years, I have learnt a lot from him. Apart from that, I had a very good exposure towards ortho-onco, because there is a very good ortho-onco team there. Orthopedics, of course. So by 2013 and 14, I could understand, and though it's a very fantastic experience, I could understand the physiotherapist role in the hospital was much limited, maybe pre-operative a little and then post-operative. Most of the things are placed at post-operative for physiotherapist, be it home or at an institutional setup, a rehab center. So I happened to explore this. I happened to resign from Citizens at a very good position, and then I started exploring the world. I went to Singapore, found very good practice models there in Mount Elizabeth, and then
and this was in
2013 and 14. And then I moved to Dubai. I have done some internships there. I also observed CMC model of rehabilitation in Vellore, and I've been to AIIMS Delhi. So about 30 to 40 institutes across the world, including US, John Hopkins, T.R. Herman. Such institutes I happened to visit and then understand what is the gap that India has got. I was thinking it's only OPD model. So this is the model which I was working is on inpatient model, where I've realized the value of close monitoring, especially first 3 months post-stroke, complex head injuries and spinal cord injuries. These 3 months are very crucial, I believe, and it is proven, versus home versus inpatient. It is not that home is not effective, but IPD, inpatient rehabilitation, proven to be giving better results and accelerated results versus home setting. Once the subacute phase or the patient started getting his motor controls back, I think that's a time where patient can move to home care versus OPD settings.
Well, that's a fairly long and diverse career where you have traveled widely. We'll come back and then discuss the professional side of it, but since this is more about knowing you, you mentioned you have visited several countries. In your opinion, perhaps can you pick 2 or 3 countries that you think are great just for travel?
For travel, Europe is always my choice. Be it Zurich, Europe, any part of Europe is really great.
And do you have any specific liking for particular cuisines, food?
I mean, by heart I'm Indian, so
along with Indian food.
I'm a great fan of Chinese cuisine. Chinese foods are really diverse, and the taste is really different at each each corner of the Chinese. This thing. So apart from Indian, in Asia, Chinese is my favorite.
A little bit more about perhaps your personal life, maybe from a digital perspective. When did you first get your mobile phone? I'm assuming we are so-called part of the generation which transitioned from the landlines to mobile phones. So do you remember your first mobile phone?
Yeah, if I can rightly remember, it is Nokia 1100, like world's famous or most liked mobile phone. This is only after my first salary in Kokilaben, post my education.
Mm-hmm. And if you still remember, sir, your first bike, car?
I drove a two-wheeler Apache, TVS Apache, and then I moved to something called when I like Chevrolet. They're but I don't now they are not there in India. I drove Spark Chevrolet, and then now I'm driving Maruti.
Wow. So,
I have an EcoSport though, but still I like Maruti and then Chevy.
okay, great. Perhaps that's due to your travels in the Middle East
Yes, yes,
and in the Americas, I
yes,
guess.
yes, yes.
Um, so, I mean, we listen to a lot of your career trajectory, and the reason that we are perhaps having this discussion is, as you are aware, we are starting up India's first school of digital health, and again, we are in a stage where the services that are done in an analog way are slowly again transitioning off to a digital platform or a digital way. And this is where we need to understand from people like you who are actually in the forefront of this transformation and see how things can perhaps become better. In your opinion, I mean, perhaps let's say to extend into the imaginary area, what do you think would be the digital health service that you would actually imagine? Not necessarily from the physiotherapy viewpoint, but rather if somebody says this is a great digital health service, what would be something that you would perhaps start imagining? Sir?
As I looked at many models, healthcare models, most of them fall into curative model. But I see digital health tech should empower preventive side of it, monitoring the lifestyle, understanding the lifestyle choices, be it food, be it exercise, be it behavior. So this sides of it actually cumulatively make the person sick when they are not aligned well. So I believe if digital tech, healthcare tech is coming on, I think it should empower the person to delay the sickness if there is already a great sickness, or to lengthen that healthy living area of life. So that makes much more meaningful when a digital health tech comes in. And what I believe, we have a lot of gadgets, be it watches, and a lot of things have come to the level where people can wear a ring and then understand entire metabolism. They are in bits and pieces. What if all these devices can talk to one platform, and then it gives you an understanding that what is the health today, and what are the goals that this person can really reach. Because we have a lot of imaginary goals. I should walk for 10,000 steps, or I can go to trek something and all. But what is so much ideal for this age and then that individual capacity, that goal will be only coming when this kind of amalgamation comes into one given platform.
Yeah.
So that is really fascinating if something can be done like that.
I think these are some of the areas that we are also hoping to focus on. Perhaps to maybe if I can summarize, I think digital health would be a great platform for prevention. Everybody says prevention is better than cure,
Clear.
but actually there is no kind of an ideal platform for prevention.
Yeah.
And even if all the so-called, as you rightly mentioned, all the components are there, it's not in a comprehensive platform. It's all distributed across. You need to meet let's say hundreds of people, if not dozens of people, and then you need to follow different types of advices. And even if they give, we do not know if they are actually customized to what we require. Perhaps as per the maybe age category, gender, location. So I think as you are perhaps imagining, digital health is maybe when it works, and I guess there's still some way to go, would be the best platform for the customization part, making it comprehensive, and also kind of telling people a little bit ahead of what is actually happening, perhaps prediction or as it goes forward, prevention also. Uh, Coming to physiotherapy as a service, what are all the maybe let's say top three or top five services that people actually come to physiotherapists? Why do people actually come to physiotherapists? You mentioned that post procedures or post surgeries, of course, doctors send them to physiotherapists, but largely top three or top five services that you can think why people come to physiotherapists.
So I would take you to a little to the past and then now, so it makes a lot of sense. So initially, when I see why should a patient should come to a physiotherapy consultation or a treatment, is only for pain. It is believed that physiotherapists are nothing but they manage pain. They make you do some exercises using some modalities. This is all about looked at as an ancillary service, not as a main service. But as the transition is happening now, physiotherapy is got blended into most of the practice models. As I said, I have never been thought. I mean, I never thought that I can work with a lung transplant surgeon, even before the surgery is planned, 3 months, 4 months before. So we are at a prehab state where I will give an example. During COVID, we had a collaboration with one lung transplant surgeon in Hyderabad. So he happened to send 3 cases to us. And then 3 of them, though we rehabilitated well, we have to lose 1 of them out of 3. So we proposed this, sir, why don't you send us a patient before surgery that we can amplify his capacities and give him a model how he is going to travel after the surgery, which is very, very important. So he happened to send a patient to us. So he stayed about 30 days with us. So we measured the baselines and we make him understand what he has to go through and things like that. So from pain, now it has gone to the level where it is blended, like it's so much blended into the system of practice where the surgery's outcomes are better with physiotherapy, be it knee replacement or anything.
I think that's a very interesting area that you are actually proposing, which perhaps like I'm reasonably sure if it's not taught in textbooks also.
No.
Perhaps like to give an example. So even if a person needs to kind of have a surgery, if your blood sugar is fairly high, then you are actually under treatment for a while before you are even prepared or having a surgery. So I think as you mentioned, in a similar way, especially when a lot of these elective surgeries are performed for chronic conditions, I think preparing the patient for the surgery is an area that can actually be kind of expanding more and more.
Yes.
And perhaps like this is another area where digital services can play an important role, because I think here continuous measurement of all these vital indicators, parameters becomes really key, and say this is the present state, and then maybe at this stage this person is good for surgery. So I think that's a great area that perhaps like would perhaps like expand.
Yes. Top 3 areas are pain, lack of mobility, and then post-operative. It could be from orthopedics, neurological, or cardiac. These are my top 3 volumes.
So let's say they come to you for pain, and as you mentioned, post-operative. And the third one, sir?
Third one is mobility, lack of mobility, cannot walk.
So perhaps like challenges with the movements or the range of movement.
Yes.
So they come to you for these challenges or perhaps like these conditions. What do you do? Maybe one at a time, like let's take pain first and then post procedures or post surgery, and then the third one would be the range of movements actually.
Mobility.
Yes, mobility.
See, for example, there is back pain, for example. So it is believed before for back pain, it's all about, give some IFT ultrasound. These are classics of our equipment before. Now the knowledge has got expanded, and the literature is saying before the advice only rest. When someone is having pain, specifically back pain or neck pain, please take rest. Now the literature was telling us don't offer good rest to the patient. Ask him to start loading. Ask him to work on his patterns of movement, which was a cause of the pain. So we are directly now working on pain patterns management. In case of lower back pain or neck pain, that which is so much common now, we doesn't just solve their pain. I do tell to all my patients, don't come to me for just managing the pain. So first case we assess the pain, understand the pattern, how this pain is coming, and then where from this pain is coming, and what is his lifestyle largely, which was giving him this pain. Post that we'll manage, but what we tell to the patient is managing pain episode is not the case. Managing the relapse is very, very important. So that is a whole new management style that is happening now. So pain, as we know, it's a very complex subject. It can be psychological also. So now I started believing cognitive behavioral therapy is having a great impact on chronic pain setting, especially musculoskeletal. It has a very profound impact. So now we are clubbing that classic physical therapy assessment, post that management plan, and a conditioning plan which goes near about 6 to 8 months to stop relapse. And very importantly, strengthening his understanding how this pain is coming, and then managing his anxiety through a system called CBT, which is nothing but cognitive behavioral therapy. So his behavior, his pattern of lifestyle is giving him pain.
So, what you are broadly trying to say is it's not simply taking some medications
Yes.
to reduce pain,
Yeah.
but rather fundamentally looking at what are the cause of pain,
Yeah.
which broadly is poor lifestyle
Yeah.
and perhaps like poor position,
Yeah.
and actually addressing the cause of pain so that after the treatment there is no relapse and perhaps like there is actually lifelong cure or
Yes,
perhaps a,
yes.
a longer cure
Yes.
to this rather than very specific
Yeah,
treatment.
because when we place the patient into center, like the patient-centric model, where patient himself will try to manage, like he understands with the awareness that we give while doing the therapy, and he understands what is that factor that is causing him pain, which was very, very important to stopping the relapse again. But it is so boring to see the same pain patient again and again with the same complaint.
And when patients come to you for pain management, there are also additional interventions that you actually give them, right?
Yes.
What are the interventions that you give to the patients for
We
pain?
talk to them, make them understand something called do's and don'ts. What are the do's with this kind of a pain they can do? For example, if I'm dealing with a shuttler who is in peak is in his career, so his mindset is always towards starting the game tomorrow. But we make them understand, okay, this is possible now and this is not possible now. So this kind of an awareness and specific understanding, we will try to make the sports person understand. With that, we will make them understand what are the do's that he can do now, and then don'ts. If something he try to do, or something he's try to go beyond his capacity, be it a sport or not taking rest, it will again overlap on the existing injury. So do's and don'ts are the fundamental things that we tell. Other than that, now we started telling them also to meet a good nutritionist. A basic nutrition plan we will give, but to enhance their capacity, healing capacity, or enhance their sporting capacity in sports people, we are also trying to give them a nutrition advice, which also plays a maximum potential or maximum role to heal their injuries.
What are all the facilities or the technological interventions that you have in your facility that can help people to perhaps like address their pain or reduce it?
Yeah, so for pain we have a bigger fleet of equipment, be it laser, which was very advanced equipment, and we have something called cryo, which will numb or just take off the pain within no time. We also have very advanced interferential therapy and then ultrasound machines, and we also have something called iTecher, which was a very advanced machine and which was very latest model, which will work as a diathermy model, and then the pain is really managed well in terms of managing the inflammation. Other than that, we have a traditional equipment, whatever it is there in every physical therapy department. Apart from that, we also started working on patients with pain, getting onto the aqua pool setting where buoyancy, the water medium offers a lot of flexibility for the joints to work versus in the land. So aqua pool, aqua therapy also looked at as a very much into the pain management role now these days.
While you are actually delivering these interventions, how do you get the feedback from the people or the patients to say that things are actually getting better?
Yeah.
Do you do any kind of measurements, or
Yes,
it's essentially people telling that I'm feeling better?
Yeah.
How do you actually
Yeah.
do this?
So this is a very learned question from me. Like this orientation has come for me over the time, and then it led to a lot of developments in the area where I'm working. Fundamentally, I started working. When I started working, I have few scales like pain scales, like VAS scale, etc. But I started believing this is not just enough to understand exact pain. They may be rating pain, but that pain scale is very subjective. Whatever I say, it is going to be the case. But how do, as a clinician, I can also interpret the pain? So that's when I started using certain measurement questionnaires. They are objective questionnaires as well as subjective questionnaires. Apart from that, traditional scales anyway I am using, but I started working on one model where pain and then the mobility. Because the improvement in the mobility is a direct relationship with the pain management. If pain is less, the movement will be improved. So even that we are measuring with the devices that we have.
Um, I was actually reading through a paper that was fairly recently published or perhaps just accepted, and also talking to one of the startup companies last week, I guess, and we were also discussing something fairly similar. How do we get feedback from the person on how this pain management is actually kind of helping them?
Yeah.
And maybe this is something that we can perhaps continue discussion and work with. If we can perhaps maybe use digital services for understanding facial reactions while the procedure is actually being given, or perhaps measure galvanic responses from the skin,
Yeah.
or perhaps heart rate, respiratory rate. So some kind of a multimodal, and as you rightly mentioned, I think we need to broadly move away from very subjective responses where, after maybe 2 or 3 sessions, a person might actually say, I'm feeling better, and then go back to their daily life, and then again perhaps get back. So if we can get some kind of an objective measurement with a good baseline, I think this is where digital perhaps platforms could perhaps maybe play a better role also, not just here, but there are several areas.
Yes.
So how do we think, or how do you think we can actually bring in digitization into these services? Broadly, these are all technology-based services, but if we want to kind of engage with the person better, or perhaps monitor the services better, or there is now a new trend, or perhaps maybe an existing trend to deliver the same services over a longer period of time, over lower doses, kind of microdosing of medicines also. So is there any way that we can actually bring in the benefits of digital platform into this services?
Yes. There are certain concepts called patient reported outcomes, where patient report their outcomes. Outcome can be pain, outcome can be improved mobility, etc. So when it says that, when I believe this, it is not just one episodic management of pain. How do we expand that relief throughout the longer period? So it is not possible for a patient, or it is not expected him to come very regularly to the center, versus empower them with a model where they go back to their routine, follow the new pattern and the routine that we suggest, be it lifestyle, exercise, etc., and then wear some kind of a gadget, rate when there is a pain as a response, and that one particular pattern which is triggering the pain, one particular area which was triggering the pain. Maybe, for example, if I have a back pain patient, out of 10 days of recovery, 11th day, the patient maybe again started experiencing the pain. So at that time, what if the patient can rate the response, but one particular activity or a task that is indulged on, that gives us a closer understanding, a specific understanding for us to understand the system better. Because when we look at these MRIs and X-rays or other imagings, these are very static postural photographs, if you ask me. They doesn't give us a great understanding, nothing called 360 degrees understanding, because this MRI or CT is taken when a patient is lying flat. So we cannot write a lot of MRIs, of course. So to understand the trigger of the pain, to understand the trigger of the immobility or the pattern, it is very important to travel with the patient, but not that we will ask the patient to come to our center, versus give them empower them with a digital gadget or a digital technology where they can record their response. And cumulatively, when we look at the response and the rating, we will understand what is it causing. And this will fall exactly in a model called chronic disease management, not just pain. So chronic disease management it doesn't happen at the hospitals, if I can tell, nor in the clinics. It only happens at the community settings with patient-centric model, which was a continuous effort.
Interestingly, this is also one of our focus areas actually. As you rightly said, a lot of these chronic conditions happen over a life course, or perhaps you do some activities of your daily living which you are perhaps like not doing rightly, or maybe there is a specific ecosystem or an environment which is actually causing or triggering this response. So mapping all those things is extremely challenging. It's very easy to say,
Very, yeah.
let's understand how you are living, but it's extremely challenging.
Yes.
So this is where we are also hoping to kind of build digital platforms. Thankfully, as you rightly said, it's broadly possible today, but there's still a long way to go. It's very simple to say let's record your sleep, which is
Yeah,
doable.
yeah.
But if you want to record your life, whatever you're eating, wherever you're going, there are lots and lots of
Correct.
challenges, technical and perhaps like what you call as operational challenges, and then the human challenges also. So there's a lot of scope for digitalization of these services to go forward and then help the people in a much better way. If we can go to the next often used service or often provided service by the physiotherapist, what would be that and what kind of services are you providing, sir?
At our center?
Yes.
Okay, so at Athar we are largely catering to entire umbrella of physiotherapy, but our design is towards neuro rehabilitation, where we found this gap of large gap of neuro rehabilitation. As I said, I have seen in many countries. It's if you see in China, in most of the parts of Europe, be it NHS or non-NHS, parts of US, it is a government-sponsored program. It is not just managing the stroke or head injury or a spinal cord injury. It's an extended service that is going to get to the citizen of that country, where he will get a chance or support from the government to get rehabilitated also. It is also a care actually, be it insurance or anything from the government. But in India, the models are different. The government aided services are very limited or not known for me.
The the way healthcare is actually done in our country is very challenging.
Different, yeah.
But what I was kind of wanting to understand is the post procedure services that physiotherapists actually provide. So that you mentioned is the perhaps like second top service.
Yes.
So if we can kind of talk about the post services, post procedure services, I think that would be great.
So we are positioned at where what a physiotherapist can offer entire umbrella course, be it pain management, pre and post surgical.
To interrupt again, typically when we say post procedure, what kind of procedures are we talking about?
We are talking about brain strokes.
Okay.
We are talking about head injuries, post head injury surgery managements, post spinal cord injury managements, post knee replacements, post fracture surgeries, post any orthopedic procedure surgeries, and post cardiac surgeries, post lung surgeries. Also into sports trauma, post sports surgery management also, we are doing a very good job.
So after the surgeries, they broadly come to you, or perhaps like they are still in their post-operative care, and then you take over. What kind of services do you provide?
So for example, neurological, if you take, we understand neurological rehabilitation is not with only physiotherapy. So we have occupational therapy, which will empower activities of daily living for the patients, like eating, combing, grooming, drinking water, being in the kitchen, etc. Physical therapist, of course, works on building the strength and mobility, and then getting back their gait, etc. And speech and language pathology services, where patients are affected, they cannot talk, they cannot express. So such services are also offered at our center, as well as something called dysphagia, which patient cannot eat well, swallow well. So we also offer dysphagia services. And very importantly, we offer something called psychological, as I said, it's integral part. So we offer something called CBT, cognitive behavioral therapy. All these patients will get affected with their cognitive function or behavioral function. They will be depressed because they are dependent and impaired. So these are the broad categories that we have, along with very advanced aquatherapy service.
So is there any technology based or digital services that are being offered in the area that you mentioned?
Yes. So it is very exciting to see the gym. When you see our gym, we have a class of robots, be it training the gait. For example, someone have to walk a post stroke or post head injury. It takes 2-3 people support, and then the attention span is very less for the patient. So when we ask the patient to walk or move his foot, it will be very difficult for him to keep and lift and keep his step. But versus when we position the same patient in the robot, it is very easy for the physiotherapist to program, give the right parameters that patient can walk, and the patient also will be encouraged to learn and then participate more because of the advantage of the technology. So when he started walking, he'll be able to see on left and right leg what pressure is going on. Is he keeping his weight towards the left only or the right only? What is the percentage? To that level, it can be viewed by the patient, as well as it will be because of the robotics technology, the patient is given a lot of experiential learning. Like when he is learning, when he is walking on a robot, he will feel that he is as if he is exactly walking on a sand or a water. So that proprioceptive feedback is also given to the patient. So these kind of a reinforced learning, if you say, will actually make the patient recover faster than normal manual course.
So I'm assuming these are all the same interventions you'll be also considering for people to improve their mobility also.
Yes, yes.
So broadly, to again quickly summarize, the three areas that physiotherapists would be helping the people would be for pain management to start off with, and post-surgical or post-procedure rehabilitation, if I can call, and also to improve the mobility or the range of movement.
Yes, yes.
And in all these areas, you see new technologies that are actually coming up. In your opinion, sir, what would be perhaps like the maybe top 2 or top 3 new technologies that you think can really transform these services?
So when it comes to pain, mobility and all, assessment services and therapeutic services both. So if you see top 3, top 1 would be, I always love EMG technology, So EMG is one technology which can actually empower the management of mobility as well as the pain, because it gives a direct feedback of the muscle condition and the movement condition. Number 2, I should say that as we are discussing even before, tele-rehab or the community-based rehab technology that should come in, that also will play a greater role. And number 3, artificial intelligence, if some technology can predict the recovery models and then based on the data that we have, that also can empower the recovery trajectory. The right clinical decisions can happen.
VR is actually becoming past like very applicable in pain management. What is your opinion about the VR in pain management?
So VR has a profound effect to I have a personal experience. So I was trying this VR headset for a few of my patients. It's a neurological pain, of course, post spinal cord injury. So this patient keeps complaining of a lot of pain while doing exercise, etc. So we did use this VR headset for about 3.5 weeks. We could see the patient reported that the pain is much more lesser. What we've gone back to literature and saw, there is a very much impact on a neural level, a neuroplastic level, where the pain is moderated by engaging him with this kind of a closed VR setup, making him do exercises without great perception of movement, so that his perception of pain is dimmed at a central level, or the engagement is more towards mirror training, like the headset that was there kept on the patient head will be giving some exercises to do. So when the patient try to mimic as a mirror motor training, the pain is perceived less. It is not, pain has not gone anywhere, but he will feel less of pain. Consciously his pain is less when he is doing this movement. So that way the VR headset is, VR technology is definitely offering, but I feel it has a very long way to go, though its scope is now expanding across. But I should definitely say VR has a definite impact on pain management.
I think one more way VR actually, I wouldn't say helps, but kind of modifies is the way you relate to the external environment. So in most cases, as we are discussing, the external environments do contribute substantially to the perception of pain. And you put this person in a very different environment, and in some ways the distraction actually maybe helps the person focus a bit less on pain, which
You hit the point. Like
yeah.
distraction is what is the technology of. We are on the pain. So distraction
Yes,
is what is created.
I think this is a positive distraction because there are a
Yeah.
lot of people who simply keep saying
Yeah.
that digital technologies are
Yes,
very
yes, yes,
distractive and
yes.
then keep blaming. So this is some kind of a
Yes,
useful
yes,
distraction,
yes.
I guess.
And a lot of scope is there to, because as we know now, VR technology can offer something on pain management. Having said this, the next question when we propose this technology to patients, how long, how much dose, and what is the outcome, which is not standardized yet. That's what I was talking about. There's a lot of scope to understand around this technology to really prescribe. When it comes to prescription of pain, it should be standardized and approved and things like that, protocolized, etc.
I think the moment you start talking about standards, it's always like from an academic perspective, it's great to listen because that's where we would actually want to perhaps like explore and contribute. In fact, mentally, already stitching together things that you mentioned, or perhaps the ones that we discussed. One is VR can actually help, but the requirements here, as you mentioned, are standardization. And again, going back to the term about feedback, about how the people actually respond to pain. So if we can add up maybe a bunch of monitors around the body,
Yes.
and then perhaps like transport them to a different environment, and then as you rightly mentioned, we can add robotics to the picture, perhaps like exoskeleton. So that would kind of make people look like a Robocop now.
Of course.
Yeah. So, what's your opinion on this exoskeletons? Are they already here? Are they there in your facility, or what's the situation
Yeah.
as of now?
So we don't have exoskeleton per se, but I happen to I happen to have a hands-on on them. Earlier exoskeletons have suffered with a lot of weight that is built on, and then the charging, that the battery capacity that has got. Now I have seen very few weeks before there is a cohort from research side of research and innovation circle of Hyderabad. They have collaborated with few exoskeleton engineers, and they have sent it to me for some basic understanding. So when I look at their model, they are much more offering better services, like in terms of not having, in terms of having lighter weight, better battery recharge models. Exoskeletons have few limitations, but they offer excellent capacity training when it comes to gait. So definitely, I'm looking forward to look and then practice such exoskeletons if they're offering better offering in terms of having lesser weight, more recharge capacity.
So, I mean, broadly, we can think or look towards the future and say that there's a lot of potential
Yes.
for
Physiotherapy.
services. At least I will kind of focus more on the digital side of it because that's where we would want to focus, and also that's where I think the market is actually would be growing
Yeah.
also. So if we look at the global market, I was kind of searching for information, obviously on Google. It looks like the global physiotherapy market is about like $100 billion, and India's share is extremely small, like
Yeah.
just about 1 billion.
Yes.
And this is also one area where there is an extremely large scope, especially on all these new innovations that are actually happening on the digital platform. Uh, Also, maybe one more statistics to refer with. It seems like in countries like the Scandinavian countries like Norway, Finland, there are about two physiotherapists per 1,000 people, whereas in India it's actually one per 20,000.
Correct. You're correct.
Which broadly means that we kind of have a shortage of at least physiotherapy services by 40 times.
Yes.
Or perhaps like even with all these digital services, I think maybe if we look into the future, the requirement would perhaps like be 50 times or 100 times from now, because as longevity actually also comes in, when people live longer, and there are going to be more and more chronic conditions, when maybe even prevention actually comes into play. So the services are only going to exponentially increase. But the challenge from our side, and also for people like you who are actually setting up facilities, not just being a physiotherapist who's delivering a service, if you want to set up certain facilities, you need people who understand all these new services and also would be able to work and deliver. So, fairly very simple question: how do we train these students? How do we kind of teach these things to our new students?
So in terms of patient and therapist ratio, it is, yes, definitely 20 to 40 times we are lacking. And then this lacunae, it is not cooked up lacunae. This is all about the service scope that physiotherapy has got expanded towards. As I said before, it's only pain management. So the ratio is fairly enough to deal such pains. But now it is discovered role of physiotherapist in different areas, right? Pre and post and longevity also. So that's when the ratio of therapist versus patient has become even more exponentially high. When it comes to training them the skill set, it is not true to believe colleges can deliver everything. I believe what if an institute establish a collaborative system where even the industry will start coming into the university and then start collaborating and then teaching what is market requirement. Today, if I see the student who is coming into my premise post graduation having 2 years of experience, they doesn't understand what is the tech side of rehab, what is the data value of data that can offer him to get a very importantly to can get him a predictive analysis of the patient. When the tech side is rapidly growing, the technology is actually building up a lot of robotics and things like that. The curriculums are still stringent and then they're rigid. So that's when the skill set that is coming on to the market is lacking that, and then still the dependency of not having skilled resources even brewing up. So I believe rightful collaborations from the college times, from the universities or the colleges, with the market will have a holistic management of skill set, as well as a rightful understanding what is the ratio, what is the right ratio of physiotherapist and then the patient. Will also empower the skill as well as the ratio side.
Well, that sounds great, sir. And also, that's one of the reasons why we have kindly invited and you have agreed to join on our board of studies. So, relatively speaking, the challenges that you mentioned, which is the fact that the curriculum that we teach is not reflecting the requirements on the field or perhaps like in the service facility. I think we would actually want to change those things. But if we can get a little bit more specific, can you again perhaps like please tell what would be the top 3 skills or top 5 skills that the new students should be learning, apart from the fact that they should also know the contents of the physiotherapy curriculum fairly very well?
Yeah. So when we see top skills is always, I believe, assessment or diagnosis is a top skill for any clinician. So when we look at the college institution level, it is very narrowed, I don't say narrowed, but very specific assessment pattern that we follow. The same assessment questionnaire or a paper that is given to every patient. But this patient won't be able to fit, may not be able to fit to that assessment pattern. So upskilling or upgrading the assessments with a lot of comprehensive models, which is very specific to that particular conditions, gives a very fair understanding about diagnosing the patient. Number 2, offering a great level of choice of therapies. It is not just therapies that are available in that institute. Maybe out of the circle, out of the institute, there are many other therapies. Having that hands-on also will actually add on to the skill set of the therapist. And also the third one, very important thing is creating a communicative environment. For example, if a patient starts, it's a complaint from the patient, when patient starts talking to the doctor or a therapist. So it is a belief system that patient is interrupted within 10 seconds. This is a classic. So make them understand listening is very important, and then communication is very important. Giving empathy is very important, which was not definitely taught, but this is very, very important aspect when you deal a patient.
From the technological perspective or from the digital side, what new skills do you think the students should be taught? Perhaps, as you mentioned, things like analytics, or maybe like, let's say if we are using the exoskeletons to help the patients, like what are the new areas that students should perhaps like know, understand, or what are the things that we can actually teach them?
So again, it is condition specific. We should give them bunch of conditions which are dealt manually, very traditionally, and what are the newer technologies that are coming into this field to offer better and enhanced results to this patient. For example, when we see a stroke rehabilitation or a spinal cord injury rehabilitation, gait makes a maximum role of recovery. So what are the such technologies that are available, and what are those technologies' impact on the patient recovery? When this patient can be adopted to this technology, and what are the outcomes that can be expected? Apart from this, giving an understanding about the technologies, as well as how do we, when you use a technology, it is not just the technology side of it, but how do you get a data from it, understand, compare across the timelines, as well as compare across the patients, so that tomorrow when I use same technology, how using this data I can harness what therapies have worked for this patient, what therapies have not worked with this patient. So this gives an understanding and thoroughness before we actually propose a treatment for a patient using a technology based therapy.
Well, thanks a lot for kind of listing the skills that can be taught, sir. And you also mentioned that facilities such as yours and the one that you studied, Kokilaben Hospital. Uh, can you also list maybe some other facilities either in Hyderabad or in our country where technology based or digital based physiotherapy services are being provided?
So I'm hearing, we have one more branch in Mumbai, that is one more Atharvability, and we also have very good setup. I heard, I've not been there. Abhinav Bindra Institute is also doing a great job in terms of empowering physiotherapists with a lot of technology. And in Hyderabad, we have something called Center for Spine Research. They have very good technology towards spine deformity assessment as well as sport assessment facility. They have two facilities, one is in Jubilee Hills and the other one is at Puliyal Gopichand's Academy. So we're trying to collaborate with them to give a close understanding between research as well as clinical exchange program. So that is one more good facility. And I think Chennai there are few, and then few are in Delhi. When we are coming in Delhi now, very few days.
Oh, great. Well, actually, I've been to Abhinav Bindra's facility, but that was in Jorhat actually in
Yes,
Assam.
yes,
It's a really fantastic facility. I mean, I would have never seriously thought all this equipment and all these services are actually available in the Northeast,
yeah,
perhaps like one of the best
best, yeah.
services. And we are also hopefully very soon starting up a robotic research lab
Oh,
where we would also start working on exoskeletons and perhaps like add up small areas like
okay.
maybe train a robotic hand to help a patient or
Oh,
perhaps like maybe see if a humanoid can actually walk around
yeah,
or perhaps like focus on proactive devices which can detect falls.
yes,
So these are some of the areas that we are also hoping to focus on. So I think this will be a great platform or a great area to kind of collaborate also.
yes. Because you mentioned hand, rightfully mentioned hand, glove and all, which is having a bigger scope than any other robotics if you call today. Gait robotics are solved now, a lot of gait robotic models are coming. But upper limb models are still in need. If you can do something there, it will be great.
Well, I think we have a lot to kind of perhaps like collaborate and as perhaps maybe a quick summary. I think digital platforms would help in getting a lot of feedback for the existing services, and it will also help us to provide the services continuously. And digital plus either VR or maybe add up the projection as an artificial intelligence, which also helps with customization, add up robotics. So if we kind of perhaps make a even a very small list of new technologies that can be kind of added up to physiotherapy, I think this is very exciting to work with for the patients and also for the normal people who, as I mentioned, are all living longer. And I think they would also start benefiting
Yes,
from some kind of a pre-assessment or perhaps like a life course
yes, yes,
interventions on how to kind of live their life longer, live their life
healthier,
better.
yeah,
So I think physiotherapy might actually become something like a lifelong service
yes,
also. so that people can actually live their
Yes,
daily life in a much better way and a much more convenient way, in a lot more mobile way.
Yes, yes.
So I think these are areas that we can actually follow up, and perhaps like
Yeah.
maybe sometime later we'll have another discussion to
Sure.
continue.
Get better quality of life as long as the longevity is there.
Yeah. Well, thanks a lot for all your ideas and thoughts, sir. And well, we should perhaps like stay in touch. I'll come and visit your facility,
Please.
and we will actually request you to come to our facility a bit more frequently, and
Sure.
hopefully talk to our students also at some point in time.
Sure.
Well, thanks a lot for kind of.
My
coming
pleasure.
to this.
My pleasure, sir. Thank you for having me here. Thank you so much.